Hi, we're in the home of Marie. She's 54 years old and she has been on testosterone replacement for a little bit over 4 years. And we're here tonight for her to tell her story. So, what were the problems that led to you going on testosterone replacement?
Well, getting married. I was newly married and I was having trouble. I was about 48 years old, newly married, and 2 years into my marriage, which was I started to not want to have sex with my husband. I kept pushing and delaying. My orgasms were very, very flat. It was nothing like I had experienced in my life before. And I was very disgusted. It was causing a lot of problems in my marriage. So being in the business that I'm in, I have a lot of people that I talk to, women, and one of my clients mentioned to me that she had gone to Dr. Barry Gordon and she was very happy. She was about my age and she had the same problem. So she gave me your number and that's why I called you, and you know, it's been successful ever since.
Okay, well, we'll get to that in a minute. This sexual problem you were having, how long had you been having it before you first contacted me, would you say? Was this a couple of years, or 5 years, 10 years, or did you really start?
It just started. I don't let things, you know, linger.
Did it seem
started, it bothered me, and I pursued it. So I would say 2 years into my marriage, I was about 50, and it started bothering me, so I started talking about it. So I would say right away, as soon as it started happening.
And these symptoms were progressive? They continued to get worse? Or was it really so bad?
I'll put it to you this way. If sex was on a 1 to 10, where I used to always want to have it all the time, I would be pushing it off where I'd put it on a 2. It went down to a 2.
From a 9 or 10?
From a 9 or 10. So it was
Okay.
like dropping rapidly and just like staying there. I'm not saying it was constant, but more times than not. And I was never the type to not want to have sex, especially with somebody that I was in love with. So it was really bothering me.
Now, after you first contacted me, though, about a year passed before we actually started the therapy. You had some concerns, you were hesitant.
There were health reasons. I had discussed it with other gynecologists, and you know, it was controversial. There was a patch out, which you and I have discussed, but you weren't comfortable with that. You felt this was more efficient. You could monitor my health better, so I liked that. I kind of just was to the point where it was really causing a problem in my marriage and my self-esteem, and I just felt sometimes, you know, I would have to put the side effect on the side. I wanted to pursue this.
Okay. Aside from the sexual problems, was there anything else bothering you that you were aware of at the time?
Nothing that I was aware of. That was the main reason I
sexual
contacted you, yes.
Okay, so then we started you on testosterone shots, and what happened?
Well, it took a couple times, and when it did happen, it was like, whoa. I felt like I was better than I did before it started to decrease, because I always had trouble with cramps, period times, and things like in that respect. So it almost felt like I was young, like I took 20 years off my life, as far as the orgasm, as far as the desire, the lubrication, all of those things were like an A+. So I was on board to continue on.
So you had a major benefit sexually.
Yes.
Did you notice any other effects of the testosterone replacement?
At the time, no. The only thing I did notice is I was a little more aggressive as far as my personality. I'm basically even-tempered and even flow, and I found myself, no offense to the male species, a little short. Like my patience wasn't as long as it usually was. I got aggravated with people in traffic, which was a clue.
Was that all the time, or just a part of the time between the shots?
It just happened in the very beginning when I first received the shot, and then I got used to it. And it's the same as PMS. It's a hormonal thing. I got used to it and I adjusted, and it was a very small side effect to deal with for the positive outcome that I got as a woman.
You had some change in your strength, your energy levels from the testosterone replacement?
Well, I did notice when I didn't get the shot, because I would get a little bit weaker, tired, and I didn't notice that until a couple times I was late on taking my shot, and I found myself, because I actively work out and I run and I go to the gym, I found it difficult. You know, I felt, oh wow, I'm not doing my normal workout here, what's going on? Not that when I started the shot my workout increased, I didn't see that, but when I didn't get the shot, my body was so used to that part of me that I found myself a little bit weak. I didn't realize how much it made a difference in myself.
In the strength and energy?
In my strength and my energy. And
both?
Both. Also, my resistance. I'm very susceptible when I get a cold for it to go into my chest, my lungs, and I found myself stronger in that area. I had a higher resistance to the germs that were outside. I don't know. I don't know if any of it is 1 and 1 adds 2. I just know I didn't get sick as often, and I had better breathing.
A lot of people have noted that, and I am fairly confident that it will be found that testosterone significantly stimulates and enhances the immune system. It only makes sense that it does. So you had a great effect from testosterone replacement. You mentioned one side effect was a transient aggressiveness. Were there any other side effects, undesirable side effects? You had some problem with facial hair?
I had a little bit of facial hair, yes. I never had to get, you know, waxed as a woman or anything like that. And I did find I had a little bit more. I had to see the beauty parlor more often that way. Yes.
Was that
my hair on my head grew more. The hair on my legs grew more.
Was it a major problem?
No, and I did find it was a little coarser, my hair.
I should point out that as far as the doses go for what women take, you're taking much more than most women. That's just the way your body works, that you seem to need that amount to have the effect. But you're taking 2 to 3 times the amount that most women are taking.
Well, I did notice when I decreased my dosage, there was less hair.
Yeah. And if it went lower, there would still be less. But you know, the most important thing is how you feel and what's best for you. Okay, now, with you, there's another whole issue to discuss with your testosterone replacement. Because at the time we started, you were having a fairly major problem with fibroids and bleeding, menstrual bleeding.
Yes.
When did that problem start with you?
In my late 30s, I started to get very heavy periods. The second day of my period, it was like my whole period came in one day. Then it got late. I mean, and that progressed through my 40s to the point where when I was getting remarried at 48 years old, I almost had to plan my wedding according to my menstrual cycle because I bled so heavily that I couldn't take the chance that it would land on the second day of my menstrual cycle. So, and in the interim of that, going along with different gynecologists, they diagnosed me as having fibroids. That's what was causing it. I was told I didn't have to remove them, we could watch them. They're not cancerous, but I did have another gynecologist that said there is a percentage that could go that way, so I had to see my gynecologist more often than the regular person. But they caused me a lot of discomfort. They really limited me. So I was disgusted with that aspect of my period too.
Was there ever any talk of having a hysterectomy?
Not a hysterectomy. I was told I was referred to go to a couple for different procedures, and I just wasn't ready. I have a cousin that said when you go into menopause, they'll shrink. So be hopeful for that. And I just figured I'm 48, it's going to go. But
so
it
anyway, it what? It didn't?
No, my period didn't go away. It kept coming.
But the testosterone replacement had an effect on all of this.
Well, that was the funny thing. Now, I was new with a new gynecologist, and she was on board with this, but she told me to watch. It was controversial, so she wanted to be, you know, kept abreast of what was going on. And she knew I had fibroids. I had an 8 centimeter. I had 3 of them, and one was significantly big. I think it was 8 centimeters. I'd say maybe the 3rd visit or 4th visit, and I went every 6 months, I was in for a checkup, and she did an she checked me before, you know, I was in for a sonogram, and she said, everything looks fine. I said, how are my fibroids? And she said, what fibroids? No, and she had to actually look on her chart. She had forgotten that's how much they shrank. Now, this was after taking the testosterone. I was
For
on
about
it
2 years.
a year and a half, around there. I was on it, and it shrank down.
And all that period, though, the menstrual bleeding had been decreasing.
It was starting to get much better. So, yeah, I even had 1 month where I skipped when I was on vacation. I thought it was vacation.
Okay, but you still had fairly regular menstrual periods for about 3 years after this.
There was only, I was not the type of person to skip. I had a regular period every month.
So it was 3 years before your menopause that this was going on?
Yes.
Okay. Okay. What would your recommendation be to other women who were having your problem?
See you.
And get testosterone, or in some way get testosterone.
Yes, it has helped me. Now, I don't know long-term how long I'll need to be on it, but for this part of my life, which I still feel, I wasn't ready to give up that part of my life, my sexuality, and that's what was happening to me. So I feel the benefits are numerous for me.
I think you'll find that you'll never be ready to. Okay. Thank you very much. This was very good.
You're
Thanks
welcome.
a lot.